Catholic Healthcare Services' mission is to extend God's healing message through our work with the frail elderly who are in need. Our work in healthcare is an extension of the Church's pastoral mission to care for those in need.
Catholic Healthcare Services is an organization, mission-driven, dedicated, committed to the care of the poor, frail, and sick elderly.
Mission today with seniors is to let them know that they have value and meaning in their lives. We are a faith-based organization, and we give seniors a sense of hope about who they are, what they've contributed, and what their innate dignity and destiny really is. Because we do believe as people of faith that they have a destiny.
We make sure that mission is first and foremost, not only in minds of our management staff, but of line employees, particularly those who interface directly with residents. Mission is critical to us delivering the kind of care that we're committed to delivering.
Catholic Healthcare Services formally emerged as a system in the early 1990s. This move coordinated and consolidated programs from across the Archdiocese of Philadelphia in an effort to grow, improve, and expand the quality of individual programs.
The genesis of Catholic Healthcare Services in Philadelphia in the Archdiocese dates back to 1913. That's when the facilities came into being, and the first facility was St. Francis Country House.
St. Francis Country House, which was a home for mothers and their children, and grew from there. The nursing homes grew up separately. Each had its own identity, sense of community, and over time in the 90s, it was seen as really the next step as to grow us as a system.
Rolling forward, we added facilities till today. We now have 6 nursing homes, several assisted living facilities, personal care facility, and community-based programs.
From this auspicious start, Catholic Healthcare Services has grown into one of the largest providers of nursing care in the Philadelphia area.
Catholic Healthcare Services over the past several years has recognized and has taken steps to establish itself as a provider of a continuum of care beyond simply the nursing home area.
Predominantly to date, we've done mostly facility-based services, though we do have some community-based programs, including our parish nursing program, as well as we have a COPE referral program for frail elders that need placement. We have that as a resource to them in the community. I think our future is a lot more community-based services. We'll always be doing nursing homes. We'll always be in the assisted living business and perhaps also providing independent living. But I think we're going to be out in the community a great deal, supporting seniors where they live at home in their communities and parishes.
Our nursing homes are transformative communities. Not only do we provide the very best in medical care, but we work to establish dynamic and vibrant communities where our residents and their families feel comfortable and at home. The continuum of care we provide extends beyond the physical by focusing on the whole person.
We're about the business of creating homes for our residents, true homes. We need to create a situation where they can still live life to its fullest. Our job as Catholic Healthcare Services is to create living environments for our residents where they can be the best that they can be.
Our staff of nurses, social workers, and counselors develop individual programs of care for each resident that are consistent with their unique needs and personalities. From active social programs to opportunities for prayer, mass, and spiritual direction, we employ a holistic approach to elder care.
Traditionally, nursing homes have been a medical model, very driven by physicians and nurses. And we saw it more as the development of a community. And within that community, the staff themselves being extremely important in terms of developing that home. They almost have to see it as their home as well.
Immaculate Mary is a very caring and loving facility. Their number one priority are the residents. And I feel their second priority are the people that work here. I came here 30 years ago looking for a job, looking for a paycheck, really. And I found a lot more. I found that I have something to offer people. It's about self-worth and feeling like you're worth something, that you have a purpose here.
One of the great rewards of working in Catholic Healthcare Services is the dedication you observe every day of the staff. We're not a facility that works 5 days a week or 8 hours a day. We're 24 hours a day, every day of the year, holidays. So many times you'll look back, you'll look at the clock and say, somewhere in one of our facilities, there's a staff member that gave up this time, this day, this holiday, working this time of night to care for residents.
They're frail in their old age, and they depend on other people to do everything for them. So I put myself in their place. If I needed to have someone do something for me, I would want that person to really do it from their heart.
The relationship I have with my coworkers on the floor is great. We like family. We help each other out. We teach each other and learn from each other.
We've been together a long time. We share all of our emotions together. When we have a wedding, we all have a wedding. When we have a baby, we all have a baby. When we experience a death, we all experience the same sadness.
This can be hard, demanding, frustrating work for everybody that does it in our system, and that includes me. The staff are the ones that pick you up. A certified nursing assistant walking down the hall and seeing her doing the job and speaking words of comfort and love to a resident is something that inspires me. So yeah, on the days when I need to be picked up, it's the staff around me that pick me up.
It's inspiring, and for those of us who are in the position of overseeing these operations, we have all been there and seen it. And none of us lose track of the fact that what's going on behind the scenes every day.
We are a church-run organization, and by that we believe that all folks need to be treated with dignity and respect. And that we've looked at our benefit package and want to make sure that the people that work with us are taken care of, that they can view this as a career, and that they have the benefits that they need in their time of need, because that's who we are. Not only are we here to service the residents and provide as good a care, as excellent a care as we possibly can provide, but we're also here as an employer to give our staff life and to provide them with what they need in their day-to-day lives to have as full a life as they can have.
Well, comparing this with other jobs in this field, I think the benefits and the salary package stack up quite well. Since I've been here, they've offered numerous benefits, and I feel they work very hard for their employees' benefits. I think it's a very good place to work. I think you can live a very good life working here.
Catholic Healthcare Services staff are invited and encouraged to grow professionally and develop careers in healthcare. We offer a tiered approach to our staff, allowing them to advance and grow into new positions within the system.
Yes, I do feel like I'm building a career for myself. And I am going to consider one of the programs here because they have an LPN program and also an RN program. And I'm going to try the LPN, and then while I'm in school for that, I can take up extra classes for RN. I want to go to the top.
At each one of our homes, we employ skilled RNs, certified nurse assistants, and social workers who closely interact with the residents and their families. Our staff is fully dedicated to our mission, and they are central to creating transformative communities.
I like it because my girls that take care of me, the CNA, they are very nice to me, and they are very dutiful to do anything they can to help you.
Ms. Lillian Holmes, she is so spiritual. She's like a spiritual mother to me and the other girls on the floor. She's funny. I could go on and on about Ms. Lillian. She's just so sweet.
I also like the activities they have here, and especially I like to play bingo. And then we have entertainment every week. Some type of musician or something of interest that I like is here every week, and we have a good time.
I met Lillian a few years ago, and she's a very spiritual woman. That's the first thing I learned about her. And I asked her about her church, and since that day we've been friends. Every time she goes out of the building to her church service, she brings me a bulletin back from her church.
And we have prayer meetings here every Tuesday, and I enjoy that. And that's done by some of the workers up on this floor, and anybody is invited. We talk about the Bible, and we sing and pray.
Every Tuesday we have our prayer meeting and worship service, and she attends, and she brings scripture. She'll bring a reading or a poem, and we share a lot of spiritual information between each other.
It's our staff who establish and maintain the warm, friendly, and caring environments which are characteristic of our homes. They are highly trained, and they are committed to making our homes home.
Everybody here treats you wonderful. Since I've been here, I've met a lot of friends that I mean are good friends. Our event for today was to meet our pen pals. So we met our pen pals outside, and I had a little gift for my pen pal, and she brought me a drawing that she made, and I enjoyed it very much.
Catholic Healthcare Services of the Archdiocese of Philadelphia is at the forefront of the most innovative approaches to skilled, long-term nursing care. Catholic Healthcare Services is an extension of the Church's pastoral mission to comfort and heal the sick. Our nursing homes, our assisted living facility, our residential programs and adult daycare centers, and our community outreach programs provide a caring response to the frail elderly in need.
My job is extraordinarily rewarding. It's a trust issue. I think the greatest reward we get in working in Catholic Healthcare Services is the fact that people give you their trust. And you are doing something that they want to do and can't do, and that's caring for their loved ones. So it's extraordinarily rewarding.
I came to Catholic Healthcare Services because it was a faith-based organization. It's about developing community internal to the nursing homes that we run, but also externally, leaving the seniors of our community knowing that they are loved, cared for, and are connected to the community at large. Faith is what inspires me ultimately to do what I do on a day-to-day basis, and I think what Catholic Healthcare does on a day-to-day basis. I didn't want to be in an organization that was putting the bottom line ahead of people. We've adopted a philosophic construct, if you will, that should drive what we do, and that's servant leadership. And that's really where I come from in terms of serving people. I wouldn't work for another organization at this stage in my career. I've been out there a lot. I've worked for major hospital chains. I've worked for-profit nursing home chains. This is where I want to be.
Recognizing each person's fundamental dignity and that all people are created in God's image, we commit and dedicate ourselves to providing quality care to those entrusted to our care. Our extraordinary staff, along with our residents and our families, are the foundation of each home's unique character as a dynamic and vibrant community.